All right. Hello, health heads. Welcome and thank you for checking into this dose of the Healthcare Uprising. I'm your producer, Jeremy Carr, here with your host, Heather Pierce. So, what's on our agenda for today, Heather?
This one's a little bit different. We're bringing Mark Urick, the executive director of the Health First Foundation, on the show today. He just joined about 18 months ago, but the Health First Foundation has been around for quite a while, helping to support northern 5 counties in northern Arizona, around kind of indirectly with healthcare. So we're talking about in the spaces of social determinants of health, which you'll learn a little bit more about in the episode. So doing some really, really good work here.
Yeah, it's social determinants of health is a term that everyone's going to start needing to become familiar with as we move forward in this country in the near future.
Yeah.
So yeah, and we get into some local Flagstaff weeds in this one too, which is cool. So yeah, here we go. Without further ado, here's our conversation with Mark Urick from Health First Foundation.
Hi, and welcome to the Healthcare Uprising podcast. Today we have with us Mark Urick, Executive Director of the Health First Foundation, which is located right here in Flagstaff, Arizona. Welcome to the show, Mark.
Thank you for having me. Appreciate it. Long-time listener.
Oh, cool.
Love it. Yep, Mark's a fan, and Mark and I.
Good to get the locals.
Yeah, when we're friends. So full transparency, our kids have been friends since basically birth. So, and Mark just happens to be the somewhat new executive director of Health First Foundation. So sitting right here in the world of healthcare. So it just seemed like a perfect fit to have you on the show. So
yeah, appreciate it. Look forward to it. Yeah.
Yeah. So tell us a little bit about Health First Foundation, how you came to join them as their executive director, and really, what does Health First do for Northern Arizona?
Yeah. So Health First, we support and also raise money for organizations in Northern Arizona, the 5 counties of Northern Arizona, who are working to address these social determinants of health or community health. So, the way I explain it, those are the basics: housing, food, access to certain types of healthcare, environmental factors, those types of things. And so we are able to give grants every year, and also we'll run a campaign or two during the year to raise money specifically for organizations that are working in that space. Yeah. I've been here for 18 months. I was a frontline fundraiser in college athletics for 20 years or so, working at several universities across the nation. Basically, in summer of 24, I got a call from someone I had worked with at NAU, and they said, "Hey, we're going to go through some changes at Health First. I'm leaving." She was the CEO at that time, and she said, "I thought about you." And so she kind of gave me the rundown.
Yeah.
At that time, I could tell you a lot about football and basketball, but I had no idea, no knowledge of community health, social determinants of health, any of that. Obviously, having worked as a frontline fundraiser, I understand foundations and have been part of foundations. But one thing led to another. I answered the questions right, I guess, and landed here about 18 months ago. So very interesting, but that's the quick story of the process, at least. Yeah.
And you and I remember early on had a couple of conversations because I had been in healthcare for a while. So we had a few, I don't know, what can I call it, a very informal working session to try and educate you a little bit around healthcare in Arizona. So that was fun for me, by the way.
Yeah,
So.
yeah, I know. I recall that for sure. I had very few. Well, I had a handful of resources, and you were one of them for sure. Yeah.
Yeah, that was early on.
Yeah, for sure, for sure.
But Health First has not been around for only 18 months. Can you give us kind of a little bit of a background? Because I think actually a lot of people here in Flagstaff and Northern Arizona, right? Since you serve the 5 counties up here,
Yeah.
don't even know who you guys are. So, and I guarantee you, for even somebody listening that's not here in Northern Arizona, there's probably a similar Health First Foundation where they live as well. So,
Yes.
which might be interesting to get more of you folks on here, but maybe you can give a little bit of the background of Health First Foundation, maybe like its origins, how it came to be, because I know it's kind of changed and evolved over the
Yeah.
last few years.
Yes.
Yeah.
So Health First in its current incarnation, what we are now, um, started in what would have been 23, okay? But prior to 23, Health First was not called Health First, but it was essentially the foundation attached to the hospital.
That's Northern Arizona
And
Healthcare or Flagstaff
yes,
Medical
yep.
Center here.
Excuse me,
Yeah.
here in Flagstaff, you bet.
Mhm.
And had been for years, going back to I think 2016. Uh, Unfortunately, there was a lawsuit that developed. The foundation wanted to separate from the hospital. I think there was some executive headbutting going on. Uh, One thing led to another. There was a lawsuit. The result of the lawsuit was Health First spinning off from the hospital, becoming Health First. And then as part of that, there was certainly really the lawsuit was over a big ball of money. So the
Mm.
big ball of money got
Isn't it
split.
always?
Health First has some, hospital got some too. And fortunately, that's a ball of money that we have under management, and that allows us to function as a single employee foundation, but has the ability to give away hundreds of $1,000s a year. So
Gotcha.
that,
Okay.
that's the origin, real
Hmm.
quick. So uh, the lawsuit, the hospital, that's all prior to me coming in. I had very little knowledge of that. So for me, really, Health First is what it became, I guess, in 23, and has been ever since, right? So
Okay.
yeah,
Cool. But the
yeah,
mission has never really changed. That's ultimately to support the community through the social determinants of health
yes,
initiatives and things of that
exactly.
nature.
So yeah, exactly. Even when the foundation was affiliated with the hospital, they did give away some community grants,
Hmm.
but really the primary function was to raise money for the hospital, right?
Hmm.
Uh, so when the split happened, the mission became full-fledged, 100% community health, social determinants of health, and supporting organizations that are working in those areas. Yeah,
Gotcha.
yeah,
Are,
yeah.
are you guys working with all the transitional housing stuff over on Lucky Lane? I'm going to get really Flagstaff local here for a second. But there's a lot of stuff in Flagstaff going on with the whole
Housing.
the housing side, which is social determinant, right?
It is.
So,
Without a
are you
doubt.
guys in that realm? Or,
Last year we ended up giving a grant to Flagstaff Shelter Services.
oh, there you go.
There
That
you go.
helped. Yeah, that helped for the operation of the Crown,
Ah, okay.
which is the old
There you go.
hotel on 66 that they converted
That's
into
right.
its family housing
Okay.
for those who are homeless.
Hmm.
So it's not just for a single person. There are youth involved,
Hmm.
and family housing. So
The place
to
actually
answer
looks
your
way
question, yeah,
better than it did before.
yeah,
Oh, okay.
They actually improved the hell out of that place. It looks
Yeah.
so much better than it did when it was just a
yeah,
hotel. And
yeah,
there's a
yeah,
restaurant in there and stuff. Like it's a legit place. But it's
yeah, for
transitional housing
sure.
now.
Okay.
And Ross, the director, she's
Hmm.
great. But so I have started working with her.
Nice.
Last year, like I said, they were able to secure a grant. Um, we did not participate in the second hotel, the Lantern, that
Hmm.
they just opened on Lucky Lane. But
That was the Motel
That
6,
was
I
the
think,
Motel
before.
6. Yeah.
Yeah.
yeah, yeah. But I went to the grand opening, of course. So
Okay, cool.
Nice.
yeah.
So even when you're not really directly involved, you're still kind of involved, like
Well,
helping things as much you can. Things.
yeah, that's really our MO. And it is kind of funny because I will get phone calls from people asking about uh, dental days, for example, another initiative that we supported. And I have to explain, we're a foundation. We helped dental days, but I don't have anything to do with the operation. And we are just in the background, like you said. That's kind of my point.
Yeah.
Is
Giving the money, injecting the
yeah,
money into these organizations, these programs
It's
that
it's like
yeah.
charitable venture capital.
it's kind of an interesting way to put it. Yeah.
That's what it sounds like when you put it that way. It's like venture capitalism, but charity,
Yeah.
which
Yeah,
Doing
yeah.
good.
blows the mind that those things could be in the same sentence, but that's kind of what it feels like.
Oh, my second.
There's more money in true venture capitalism, but
Yeah, just a little bit.
Probably.
yeah. But
Just a little.
we like to think our dollars certainly make a difference. Our grants generally start at about $50,000.
Oh, wow. Okay. That was
Yeah.
going to be my next question. Like, what kind of
Oh,
money are we talking about? Who does it come
yeah.
from? And like, what kind of, maybe talk specifically about programs? Because people that listen to this show are consumers, right? They're patients, they're community members. And so,
Yeah.
like, how would something that you infuse money into benefit them? So, like, let's get
Mm,
maybe into the weeds here a little
there
bit,
you go.
Mark.
Yeah, sure, sure. So we have an annual grant cycle. We're right in the middle of it now. We distribute money at the end of June. Uh, but those dollars, we're lucky. Like I said, we have some donors, but the dollars do come from our investment portfolio that allow us to give out the grants. We have a pretty rigorous application process, review process, and based on performance of our finances, we arrive at a number that we know we can give each year. And once the applications are vetted and scored by an independent committee, uh, we will literally line them up by score and start allocating dollars until we run out of money. To be honest
Okay.
with you, but
Okay.
we try to start at 50. We've given grants for 30 and $40,000. You won't see us giving grants for $5,000, $10,000.
Okay.
Uh,
Good to know.
yeah, and we just feel like I did inherit that, but the reasoning is we just feel like that's a good pop for an organization. It can really significantly help make a difference.
Sure.
Yeah.
Even though $50,000 to you and me might not seem like that much money, but um,
For a nonprofit,
yeah,
trying to do good for its community, that means a
yeah,
lot. That's a lot of
yeah,
money. It's a big dollar amount for
yeah,
them.
Oh,
So
yeah.
you can do a lot with 50 grand, right?
yeah. And we've certainly given, more than that, up to, over $100,000,
Okay.
more than 3 or 4 times. So
Got
uh,
it.
it really just depends on the application
Hmm.
and the scoring and the project. Yeah,
Hmm.
yeah.
And so you get this money that comes into the foundation that then is funneled out to these programs and these services and other nonprofits, I imagine, right? Like Flagstaff Shelter Services that then in turn support the community members of Northern Arizona. Um, but where does the money come from? Like, who are the partners that actually give you this money that you can then turn around and invest into the community?
So we do have, like I said, some local donors, mostly
Hmm.
individuals, that do help feed our community grant fund.
Hmm.
Um, but most of the dollars, like I said, are spun off from our endowment, our portfolio
Right.
each year. So we're fortunate enough to have that. And again, depending on its performance, we'll end up with $600,000-700,000 a year
Hmm.
that we're able to distribute in various ways, and as the board sees fit, of course. So
So the endowment, is that essentially funded by like health plans and like bigger organizations that are looking to
um,
support the communities that they maybe have a presence in?
yeah, I'm sorry.
Okay.
So the endowment itself stems from that big ball of money I referenced earlier,
Right.
and unfortunately the legal part of it. But yes, we have had, for example, this year Foothills Bank stepped
Oh,
up and made a
okay.
contribution that will go directly into our grant fund for distribution.
Hmm.
not necessarily into our investment portfolio. I don't want to get too into the weeds.
No, we don't need to do that.
Yeah. And then we also have some donors that have established donor advised funds with us,
Nice.
and they can direct the money certainly as they see fit, but I will make recommendations and where they can direct the money to go to. And if they establish a donor advised fund with us,
Hmm.
it certainly means that they believe in what we're doing.
Right.
So, right. So it's just a matter of finding whichever project we might be working on that suits them the best.
Hmm.
Yeah. Yeah.
Okay. Thank
So
you.
that's
Yeah,
where
I
our
just
grant dollars come from. Yeah.
the magic money tree.
Yeah.
Right.
It's
I mean, it's the side a lot of people don't think of with this stuff, though. Like
right.
with the transitional housing places and the shelter services, and the food banks and things like that. People never really think about how do those places actually function? Where does that money come from?
Hmm.
And it's
Yeah.
places like this that actually make it happen a lot of the time, I would imagine, right? Like it's easier for them to come to you than it is to try to raise their own money all the time, right?
Yeah. Grants are a big part of how those organizations operate for sure. Um, whether it's shelter services here or um, we've made a grant to the Arizona Food Bank Network,
Hmm.
which is actually based in Phoenix, but they operate in northern Arizona, right?
Hmm.
Uh, so a lot of those organizations they have donors, but they're sending out grant applications. Boys and Girls Club
Oh
is
yeah.
another
Hmm.
one. Red Feather Development does work on the
Oh, I know Red Feather.
reservation.
Yeah, I'm
Yeah,
familiar with
we've
them.
helped them out before, um, for sure. And they're all, to be honest, they're all looking for grant money.
Yeah,
And
who isn't, right?
yeah, and
I could be some.
we're here to oblige, I guess. But they're all doing good work, right? So sometimes in a given year, it just might not be the right fit for what we're focusing on, but it doesn't mean that they'll never get a grant from us again. You're right. And but yeah, we're happy to be in that space and can really impact, northern Arizona. We've given grants as far out as Kingman, to the medical
Okay.
center there for
That's 160
diabetes
miles.
initiatives, chronic health, issues. Addressing those types of things is another thing that we do. So a lot
Okay.
of prevention. Yeah.
Prevent. Yeah. Yeah, that's actually a good segue. And so I want to try to I know most of the money that comes from the foundation that goes to these programs is addressing social determinants of health, but is there anything that has direct impact on health, like you just mentioned, like chronic conditions, in terms of I think you just mentioned the medical center in Kingman, for
Yeah.
example, so it
Yeah.
can go directly into actual medical facilities.
Yes, right. They certainly, because most of the medical facilities do have a 501(c)(3) attached to
Right.
them. So absolutely, if they're, you know, addressing issues in that match with our mission, we absolutely will.
Hmm.
Polara Health has received a couple of grants from us, addressing some youth and family mental health issues and
Hmm.
programming that they do,
Yeah.
for sure. And like I said, you said Kingman. We've also worked with Colorado City, the medical center up there.
Oh, yeah.
This is actually, to be honest, it was a year before my time here, but we did give them a grant for some of their initiatives there.
Okay.
And yeah, so
That's really cool.
yeah,
Um,
yeah,
so where you sit, right? Like you're vetting all of these applications that are coming in for all these
yeah,
different programs, these organizations that are looking for grant money, and whatever criteria you use to assess and determine who gets that money. I have to imagine, based on those applications, that you start to kind of get to see quite a picture of health in northern Arizona. What, through that work and through that process, are you seeing, unofficially? Obviously, I know you're not an expert or anything,
yeah,
but
yeah,
like, what are you seeing as being some of the most prominent issues in northern Arizona anyway?
yeah. I think from what I've seen, some youth and mental health initiatives always involved in the application process, meaning
Mhm.
organizations are looking for grants to support that initiative. And to be honest, it seems like the needs evolve, but they don't change that much. It is housing and it
Oh yeah.
is food insecurity. And then like we talked a little bit about access
Hmm.
to certain types of to healthcare.
That's a
You know, one
problem
of
here.
the
Yeah.
yeah, one of the things that we did, this is kind of a good little story about us, is uh, we Dental Days operates here in Flagstaff, and they offer free uh, dental care over a weekend. Um, Probably 3, 4 times a year they do these,
Hmm.
and it's not just for people who may be homeless, but people who are working, don't have insurance, dental
Right.
insurance, and us, along with I think another couple organizations, gave them money to purchase all their own dental equipment and a trailer to haul it around in,
Mm.
and so they don't have to borrow equipment. They're kind of self-sufficient, and I attended one of those and got to see all the volunteer dentists that we probably all know around town, um, and then talk to the people that got the work done.
Hmm.
And that's just an area where there was a little bit more specific to actual health care,
Right.
uh, in getting teeth pulled, infections looked at, all of it. And so I got to see, literally firsthand people walking out after having procedures done, the difference that it made in their lives. And man, I mean, you talk to someone who's had a toothache for 5 months and,
Mm.
needed teeth pulled and they've just been in agony and they're just so happy. It's the truth. I talked to more than one person with these situations, and they're just so happy that they finally got the relief and the care they needed. Uh, it just kind of makes it all worthwhile. And again, I got to lay my eyes right on that impact, right? Uh, so
Yeah.
that's a good one. That's real more specific to what I would call healthcare, getting treatment.
Hmm.
Um, we try to keep people out of the hospital as best we can. It's one of the ways I explain it. So yeah,
Yeah, it's all becoming about preventatives these days. It comes up in almost
yeah.
every episode.
Yeah.
And
It is.
you talked about the needs. What are the needs?
Hmm.
Um, I mentioned the Arizona Food Bank Network.
Hmm.
Chino Valley got some money related to a grant that we did. Um, and they run a pantry and also after school meal programs out of their high school there.
Hmm.
And so I went down to observe their distribution, how they do things. Drove down there. They do a fantastic job. The superintendent of the school system down there runs it. She controls it. When I say controls it, she manages it, and they do an amazing job. I was talking to her with another couple people, and one of the people I was with said, "Hey, what's your next, what's your next thing? What if you could dream it, what would you want?" And she said, "A shelter." And it wasn't food, even though we were there for the food program. She said a shelter, and I was like, "Oh, really?" She's like, "Yeah, because we have so many homeless kids down here."
Mm, that's heartbreaking.
And I was a little beside myself. And she explained to me that she said rural poverty is different than what you see in a city. She's
Hmm.
like, it's more hidden. And she said, you really wouldn't notice. You don't drive down the street here, and see like tents or those types of things that you would in Phoenix or LA or something like that. She was like, it's hidden and you don't know it. And um, and I guess, I'm answering your question of the needs. I had no idea that would exist there. And
Hmm.
again, it's kind of like the basics keep coming up. food, housing, access to certain types of care, mental health for youth, seem to be really just prevalent in this area.
Yeah.
It's a lot of small, Northern Arizona has a lot of small, very remote towns with no local economy.
Yeah.
Yeah,
They're really hard places to live in. It's
very
not an easy
true.
thing.
And with that comes challenges with funding, right?
Yeah.
As well. So, that's why I'm happy that we're able to, to provide the dollars we can into some of these areas too. It's not just Flagstaff, but,
Yeah.
we really do try
You
to
cover a big
address
area,
rural.
a big disparate, like
Yeah.
geographically disparate area to be
Yeah, if
Yeah,
you're going from
60,000
Flagstaff all
square
the way to
miles.
Kingman, and yeah, that's that.
Yeah.
Northern Arizona's huge.
Yeah.
It's
Yeah.
huge,
Yeah.
and it's so
Yeah.
spread out. Like there's so many little towns in the middle of nowhere with nothing around. It's a hard
Yeah.
area to cover, I would think, for something like this.
Yeah. Very little urban, urban areas at all. Flagstaff would be one, which is kind of
Right.
funny because it's not that big of a town. So,
Yeah,
Yeah.
uh,
that's the perspective. Is Flagstaff's not even 100,000 people, and everybody in Northern Arizona thinks of it as the city, like
Mhm.
it's the hub, because
Right.
it's the by far the biggest place in Northern Arizona, and
yeah.
it's not even 100,000 people with the college.
Yeah.
And we're talking how many square miles? It's like 600 something thousand square miles.
I think is it 60,000 square miles?
Oh, it's 60, excuse me, not 600,
Yeah.
60. Yeah.
In the 5 counties that you serve?
Yes.
Okay.
Yeah. Yeah.
Gotcha.
So a lot of
Um,
space, not a lot of cities or urban areas.
Yeah.
Yeah.
And like, how do you decide? God, that decision-making process on those programs that you fund must be really hard.
Oh,
Yeah. So this will be, my grant cycle,
Mhm.
my second grant cycle. And I learned pretty quick that there are some hard decisions that have to be made,
Mhm.
because there are organizations that certainly deserved it, that we ran out of our dollars,
Yeah.
and just however that scoring goes.
Mhm.
We try to make it as fair and as blind as possible. I see all the applications, but it's really the independent reviewers who are not affiliated with our board, um, or have any business interests in our organization, give their
Super
time.
neutral. Yeah.
Yeah, yeah. So,
I mean, it's the only good way to do it, right? You set up your system and put it through the system. It's
yeah,
kind of, you got to, as fair as you can make it, kind of.
Yeah.
it's very fair and it's very unbiased. So that's probably the best you can do, I think. But there are certainly organizations, and I've met with these people who are funders as well, and they operate completely different. Their person or their people will go out and vet organizations first, and decide, okay, come on in, give us a grant application, and invite them in. But if you're invited in, odds are you're probably going to get some type of funding for them. So they don't have the independent reviewers. They really rely on their own eyes and own conversations, and they're on the road, visiting with these people and laying their eyes on what they do.
Mhm.
So there's two different ways, a couple different ways to do it. I don't know that one's right or wrong, but
Yeah.
yeah.
What would you say from your own personal experiences with this now, if people did want to go out and help, what are some of the best ways they could do that? Like just an average person like us that's like, hey, I want to help all this stuff happen. Are there like volunteer things? Are you guys still raising money, or are you good with the money on your end? Should we give it to somebody else?
Like, we always need money.
Well, I mean, is it?
Yeah, right.
I mean,
Yeah.
you guys are a funded foundation. Do you see it as, if somebody wants to do a donation, should we focus more on giving it to the people you're giving it to, or is it better to maybe just have you guys do it so you can put it through that system, or is it better to volunteer than like what are like the best ways that people could reach out and actually help with this?
No, you're right. And so what I would say to that is everybody's always looking for money. It's the truth.
Sure.
And so if you do have the wherewithal to be able to contribute, one of the things about us is you can contribute, you get your tax write-off, and you know at least the area that we're working in. And if that's something you believe in, we're established, and you know that, I mean, the evidence is there that we'll make good decisions
Mm-hmm.
about where dollars go.
Yep.
And so I think in essence, we could be trusted to make good decisions, and have, of course, through the years. Um, Secondly, everyone's also looking for volunteers. Sometimes it's different parts of the year, but if your budget is what your budget is, but you want to give some time, um, we would not be the vehicle for that, Health First, but you can just go direct to those organizations. They'll probably have a sheet ready just to hand you on
Mm-hmm.
opportunities to participate,
Yeah.
There you
and
go.
that kind of thing. So those
There's
are,
always opportunity, and it's good. Take your kids too, because your kids should know that volunteering and giving back is important, especially when you live comfortably. I like to remind my kids of that sometimes. I'm like, don't ever complain.
Yeah.
yeah, no, you're right, Heather. And not to start story time, but I mentioned The Crown.
We like story
Eh,
time.
but this is another example. The Crown, the hotel that's family based, right?
Hmm.
Um, I went down there, and they arranged for me to talk to someone there. And this was a woman. This is crazy, but it speaks to what you just said. She was living in a tent with her two middle school age kids, who go to MEMS. You and I have kids that are middle school aged,
Yep.
and
At
one
MEMS. Well,
thing.
mine's at MEMS anyway.
Yeah,
Yeah.
well, I got you. But I mean, can you even fathom, your child living in a tent? And that's what they
Nope.
were doing. And lucky enough, for her, she got directed to the Crown, and um, you know, the Crown is doing the work. But it made me happy to know that there are two middle-aged kids and their mom that aren't sleeping in a tent in the woods. They
Right.
have
Yeah.
a home, or at least a roof over their head, and
Hmm.
can function, probably a little more easier and a little more balanced in their life, and maybe can see, like, have confidence in the future, right? Uh,
Right.
yeah.
Actually be able to do
So
better in school and
Yeah.
yeah.
I
yeah,
can't even
yeah,
imagine
Make
what
make a
that must
whole
be
better
like.
life just from that.
yeah,
Yeah, and that's why I think we talk about social determinants of health a lot. That comes up, right? It's been kind of a theme in my work for so long, but
yeah,
it's like, how can you, put all this, I want to say pressure, but like to tell people, yeah, you know what, you should take care of yourself and you should eat well and you should be preventative. Well, how can you do that when you're living in a tent and you are unhoused, or you don't have a car? Like that's like the least of your concerns. You're just trying to stay alive and survive at
yeah.
that point.
Yeah.
So,
Yeah, you're so right. And there's areas, you probably know this, right? Not necessarily only on the reservation, but no running water,
mm-hmm.
no electricity. So we talked about Red Feather earlier.
Oh yeah.
That's one of the big things they do
Mm-hmm.
is install or fix wood burning stoves, and also install water systems
Yep.
in those areas, and for houses that just don't have that. And
Right.
it just speaks to your point there too, is, I can't even hardly wrap my head around that. Um, but again, those are the types of situations that we're looking to address.
Mm-hmm.
And little by little, we make dents in it. It never seems to end, but I told you a couple of stories. I've seen the dollars in action. So
Yeah, that's got to be so, like, I can't imagine just the inspiration of like seeing where your money ends up. That just keeps you kind of believing in that mission, knowing that you're really you're legitimately changing people's lives.
yeah, it's pretty cool. Especially, I mentioned before too, again, just spending time all in higher ed, all in the crazy world of college athletics.
Oh gosh, talk about a 180 there,
Yeah, it's
Yeah,
very
Mark.
right.
it's a very
And
different
then
thing.
to visit these places and kind of start wrapping my head around, what the issues are, and then to actually lay eyes on them up close and personal. Yeah, it's an eye-opening experience. Yeah,
Yeah.
Yeah.
You
yeah, for
know,
sure.
I'm curious, Mark, with, and I'll try, if we need to edit this out afterwards, we can do that.
Uh-oh.
You're good.
Sorry, I'm gonna get a little political here. And there's been a lot of cuts to a lot of programs, both national and international, with the current presidential administration. Now, I know you've only been in your role for 18 months, but I'm sure you have historical data to look at and things of that nature. But have you noticed a difference in the last year in terms of the programs that are being cut and where maybe you're being asked to step up more? Are you seeing an increase in applications for the programs that have been more impacted? I mean, I imagine that's got to be out there somewhere.
Yes, to a degree,
Okay.
certainly. And it's, it's in the areas that we've talked about, that also we've heard about is, um, um, excuse me, food services, right?
Hmm.
School, especially with schools,
Yeah.
that have normally participated in certain types of government, excuse me, funded programming. Uh,
Hmm.
that's our money went to some of that in Chino Valley I talked about.
Uh-huh.
Um, I'll be interested to see um, how dental days is affected, because they had been using the North Country healthcare
Oh, yeah.
um,
And that's
dental
been
space there for
gotcha.
their dental days. And
Right.
now North Country is changing hands.
Right.
It's not shutting down, but I'd like to think that those facilities are still available for them.
Hmm.
So, and that's all, a lot of the North Country, I think healthcare, again, read probably what you read, but a lot of that has to do with funding that's not coming through anymore, too. Uh,
Correct. Yeah. Federally qualified health centers, FQHCs, are
yeah, yeah,
incredibly important parts of any community. I don't care if it's
yeah,
Flagstaff
Oh,
or if
yeah.
it's
North Country's huge, dude. That if you didn't, that was the place to go in this town if you didn't have insurance.
yeah. Yeah. There's a lot of with
That was the place to go.
Medicaid cuts and I would say even Medicare Advantage, the cost of Medicare Advantage has gone up. Um, I can't speak much on Medicare cuts. I do know Medicaid though has been, and I will tell you FQHCs, and I just know this from working in the industry for long as I have. It's
Mhm.
like I think I'm sorry, I don't want to use all my fancy acronyms. The majority of the people that use FQHCs, community health centers in any community, any state, are Medicaid. And then it's Medicare after that. And then it's a really small percentage of actually like commercial insurance, right? Like privately bought or
Mhm.
like through your employer. So when you start cutting who is eligible for Medicaid and or well, again, not Medicare so much, maybe the dual special needs plans where you're Medicare and Medicaid eligible both,
Mhm.
also a big user of those FQHCs, and they don't show up, well, then your revenue's down. How do you stay in that community? How do you keep those
Mhm.
doors open?
Yeah.
So it's kind of
Yeah,
it's that whole like rural health hospital issue that keeps coming up.
It's
So
like they're indirectly defunding them. Yeah.
yeah,
Yeah.
yeah, that's
yeah,
exactly what happens. So
yeah.
anyway, yeah, anything you want to share on that you're seeing? I mean, by all means.
Uh, it's kind of like just sort of what I mentioned. It's mostly the food and then the
Right.
access part that I've been exposed to. And
Hmm.
to be honest, all the Medicaid and Medicare stuff, those are items that I'm still wrapping my head around.
Yeah.
Uh, because those certainly don't affect me or us, Health First as an organization, but
Right.
they certainly can affect the types of organizations that we can help. So,
Right.
yeah,
And
yeah,
that there could be increased need from
yeah,
those organizations because of
right.
what they're not getting. So now
Yeah,
they are more reliant on grant money and individual donators. So anyone
yeah.
listening, you got a little extra money laying around, you should, check out Health First Foundation.
Uh, healthfirstforall.org. You'll see a donate button everywhere. But our
Yeah.
phone number is at the bottom of the page, of course. And you'll see summaries of the projects we've invested into.
Yeah.
So if somebody is out there and they want to talk, or even just, throw a little money, that's fine too. We appreciate it all. So
Yeah, and Mark, I'm curious too. One of the questions I wanted to ask you is that, obviously you're just here in Arizona, you're in these five counties, and I said at the top of the episode that there's other health first foundations around the country. So maybe somebody listening's in another state. And so, maybe go find them. But in talking with other people in similar roles, assuming you do that, are you hearing the same thing? Are other regions of the country experiencing some of the same struggles and challenges as we are here in Flagstaff? I mean, every area has, like, they don't have the Navajo reservation without water and electricity, but I guarantee
Yes.
you probably going to West Virginia up into like the Appalachia, and they probably have that same
Yeah,
kind of issue.
similar kind of
Yeah.
But
stuff. Yeah.
I'm just curious, maybe what you've seen, heard, either through research or talking to people.
Yeah, it's a lot of what we've talked about with Health First and those same issues.
Hmm.
To be honest with you, I've spoken to some regional organizations. There's an organization out of Seattle, or a foundation, excuse me, that heavily invests in actually indigenous um, populations and areas. They're based out of Seattle, but they have a relationship with the Navajo reservation, and they're working on long-term solutions for these same issues that pop up, that we've talked about. And um, another organization based out of New York City, but their mission is revolving around community health,
Hmm.
and organizations that are working to, like we are, promote that. They get a little more political in some of what they do,
Hmm.
and funding, what might be called grassroots efforts and political efforts through, state governments, enacting change in that way, as well. So that might be something, although that's the only one that I've talked to, that I seem to be actively doing that. Certainly doesn't mean there aren't others. And, given that the fact that some of the funding that's been cut has been political in nature from a national level, you might see more investment by foundations on the political side of things to enact change at that level. For sure, I could see that happening for sure. Yeah,
Hmm. Interesting.
Good.
but yeah, but one of the things I think offline we talked about, or maybe you sent to me, is like, what do you see? Like, what are some success stories?
Yeah.
What's the good that's out there? Because you know it's kind of hard when you're talking to people in the food line,
Hmm.
to be honest. And
Yeah.
what I will say is that in my short time in this space, the the people that are running these, the 501(c)(3)s that are addressing these issues, um, are really, really good. And I mean, they're really looking to like maximize resources, right? And to just squeeze everything that they can out of everything they get.
Mm.
And no waste, be really resourceful and creative in what they do. And it's, again, across the board, these organizations are really well run. And so they're doing good work. And the reason they're doing good work is because they have good people running them. And then secondly, I've gotten to know some other funders. We were just talking about it, but here, that operate here in Arizona, in northern Arizona. And again, these are people who are, uh, on the funding side, really looking to just to maximize that impact, and in a sustainable way, right? you
Yep.
know, you got to start somewhere. I understand that. But they're really looking for not just this year, but what's next and what's next, and really trying to make a lasting impact. And they're also really looking to collaborate with people like Health First, organizations like Health First. And So, those are two really, really positive things that get me energized, to be honest,
That's awesome.
in this work. Yeah. And they do a great job, and they're always looking for ideas. They're looking to partner, um, as much as they can. The Marley Foundation, they're down in Phoenix. They operate all over uh, Arizona, but they give like 80% of their money goes to rural situations. I'll just put it that way, health and some other things too.
Hmm.
And then, the grant making arm of Arizona Complete Health. Now, they're not a foundation, um, but they have a wing or an arm uh, that gives money back to the communities.
Hmm.
And they're doing a really good job in Northern Arizona with their people here. I mean, Anthony's just a great guy. And so there's really creative people working on both sides of this. Yeah. Yeah.
Yeah. I I can say that I've worked with people like that because considering the previous company, actually the one I at the my newest job, my latest job, they're establishing a foundation to do the same thing because they're actually a not-for-profit and they want to reinvest any profits back into um, to the providers and the patients and the people that live in the communities that they serve. And Equality Health, who I worked for a couple years ago, they had their
Mhm.
foundation arm and they would run and they would get money from different partners, different like corporate sponsors, and they would do things that might seem really simple, but like a backpack drive for kids in August in underserved low income areas. We did a backpack drive in Louisiana that was for hurricane supplies ahead of the
Mhm.
hurricane season.
Yeah.
Um, Giving away a turkey for Thanksgiving, like we did like
Yeah.
these turkey things. So it's like events like that where you get these corporate partners and almost, I would say, generally speaking, most healthcare companies have a foundation arm to
Mhm.
do just that, right?
Yes.
To
Yeah.
yeah, so that's probably a lot of the people that I imagine that you're connecting with. So
Yeah, absolutely. Yeah.
yeah.
And they're good. Like I said, they're good people. They
Yep.
may work for for-profit businesses, but
Hmm.
they're turning around and putting money back in. So
Yeah,
uh, that's the important thing in the
right.
end. So
It's not all greed all the
no,
time.
no, and that's the point is,
Yeah. Yeah.
there's a
It,
lot of money being reinvested in.
There is.
well, that's the thing. We need to look at it as an investment in the community because the better everybody is living, the better everything works in that area, in that economy, that local
Right.
space. Like the more homeless people you have on your streets, the worse life is for everybody in that town.
Yeah.
Like there's just an equation to that
Yeah.
where you
Yeah.
judge the quality of life based on the lowest quality that
Yeah.
someone's
Uh-huh.
suffering in that area.
It's
And
true.
until you bring that up, no one else can go up either. Like that's what people who are living the comfortable life don't really understand is that making those people's lives better will actually make your life better
Yeah.
too, at least in the long run. Maybe not immediately, but in the long run.
Yeah. It pays
Yeah.
to
And
take
that
care of
that
our neighbors.
Yeah.
Yeah, yeah. And that right there is what is sort of the ultimate argument for community health investment,
Hmm.
for sure, is that it trickles up, so to
Right.
speak,
Right.
and not necessarily trickle down. And like you said, if
It's like with
it,
education. That
yeah,
like when I hear people, adults without children talk about, I don't want to pay for education. I don't have kids. It's like, dude, other people's kids are going to be in charge when you're old. Do you want them to be smart? Because I would like them to be smart.
Yeah.
So I don't have kids, but I'm all about education, man. I want all these kids to get educated so that the world's a better place when I get old.
Hmm.
You know what I mean? Like it benefits everybody. And this
no,
this is the same thing. It's the
Yeah.
same
yeah,
thing.
no, it's true. It's true. It trickles up, as we said. So,
Yeah.
um, uh, the healthier everyone is, the healthier everyone is.
Mm-hmm. Building healthier
The cheaper
communities.
health insurance
Yeah,
gets,
yeah,
and the less hospitals you need.
Actually.
And the cheaper it is to go to the doctor, because not everybody needs to go to the doctor all
There
the
is a
time.
direct correlation to healthcare costs right there, is because if you
yeah,
have people just showing up that aren't being taken care of because they don't have access or transportation or good food or blah, 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 well, they're going to get sicker. They're going to have little problems turn to big problems, and they show up at the ER because that's basically their primary care. And then, well,
Yeah.
I won't beat
It
that
just
horse.
gets more and more
Yeah.
expensive for everybody. It gets
Yeah.
more expensive for because eventually the tax system does pay for that.
Yeah.
It's more expensive that way than if we just paid for it to begin with.
Yeah. So,
Yeah, and it's not something that just, is plastered in front of your face, but it is a reality, right?
mhm.
Right.
That it's one of the hidden realities
Yep.
that people don't think about, but it ends up, costing everyone. So
Well, I'm glad that you're being part of the solution.
No.
Yeah. So, what a very positive note here. I think we can end on. The ethos of Health First Foundation is a good one. And it is, yeah, take care of your neighbors, right? Healthier communities are when we take care of one another.
Yeah.
And Health First is definitely helping to lead the charge here in Northern Arizona. I'm a big believer in the work that you guys do. But if anyone listening wants to partner with you, either like if we're thinking corporate sponsorship, so the magic money tree up here, or donate individually.
Or file for a grant on the other end of that.
Or if you're a nonprofit listening that could use some grant money, what's the best way for folks to find you online and get in touch?
Yeah, it's just healthfirstforall.org is the website. Or, if you just type in Health First Foundation in your Google bar or whatever browser you use, will pop up. And again, the bottom of every page on our website, our phone number's there, our email's there. And I'm the one that picks up the phone. So
You're the guy.
Okay.
yeah. So if I don't pick
Anybody
up,
who wants
leave
to
a
talk to
voicemail,
Mark.
'cause, I'll be the one calling back. So
And you're on social media too. I know you have a Facebook page. Are you?
Yep,
You're on
yeah,
Instagram, right?
yeah, Facebook and Instagram is where we operate,
Cool.
pretty much. And we just
LinkedIn.
try to bring awareness to community health, some of our successes and what we're doing.
Good.
And you'll find snippets of education in there too.
Okay.
All
Awesome.
related.
Awesome.
Yeah, all related.
Cool stuff. Doing good work.
Yeah, I love this. This is like uplifting. Like this is the stuff. It's like the feel good work. It's it's the stuff that changes people's like legitimately changes people's lives. So, I
Without a doubt.
yeah, you're doing a good thing. So, thank you, Mark, so much for coming on and educating us about who Health First is and how you help our Northern Arizona community. So, it was good to have you.
Yeah, thank you for having me. I know I'll see you around a little bit, but again, I appreciate the time and being able to talk about our organization.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube if you want to watch us in action.
You can also find us on social media on LinkedIn, TikTok, and Instagram. Just search Healthcare Uprising to find us. And if you're a new company with a cool new product, if you're someone innovating alternative methods for the health and wellness space, or if you have a personal healthcare journey you'd like to share with us here at The Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. Well, that's all for this dose of Healthcare Uprising. Until the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. This has been a Shut Up production.
Shut up!